it's sin. So let's go for cranial nerve 10, your vagus nerve. So the vagus nerve or vagal nerves, they are your main ones in your parasympathetic nervous system. So they control a lot of things: your blood pressure, your heart rate, digestion, even your voice, because it also works with your larynx and pharynx along with cranial nerve 9, so it'll affect your voice. So if you've ever seen somebody with a VNS, the vagal nerve stimulator, which is used in epilepsy and depression, so what happens is when that gets stimulated, sometimes they'll have a really hoarse voice, or they'll kind of talk like a robot for a little bit. But yeah, so vagus nerve is very, very important. Any dysfunction with that can cause issues with your blood pressure. So like vasovagal syncope, that's where you sometimes will stand up, or even not. You don't necessarily have to change positions. That's more like orthostatics. But where your blood pressure will suddenly drop and you'll pass out. And so that's vasovagal syncope. Usually you'll have, lightheadedness ahead of time, tunnel vision. Sometimes they'll tell me that their hands and feet go numb. And so that's what I'll see with vagal syncope. Then there's orthostatic hypotension, and that's when you stand up and your blood pressure drops. In a normal person, your blood pressure should actually go up when you stand up, because our body's homeostasis is designed to do that, even though intuitively you would imagine that gravity would do the opposite. And so that's kind of that vagus nerve. Also, it does digestion. So some issues with the vagus nerve can also lead to like things such as like gastroparesis and abdominal pain. Okay.